right, well, good morning, everyone. I'm Melissa Collins with Kentucky Youth Advocates, and I want to thank you all for joining us again today for our Advocate Virtual Forum. We are recording today's forum to share later as both a video and a podcast, so we just ask that you all stay muted, but we are taking questions and comments via the chat feature, and we will also try to answer those as we go along, either in the chat or in comments from the speakers. So again, we thank you all so much for joining us, and I will kick it to Dr. Terry Brooks.
Hey, thanks, Melissa. My definition of fall doesn't have anything to do with leaves, but I will tell you it's 18 days until college football kicks off. So that is the beginning of autumn, just if you have questions about that. As we always do, we want to welcome you. This, I believe, is our 104th time to be together. And whether you have been there 104 times or this is your first one, we want to welcome you. You will recall that this is part two of a two-parter. It began last week with foundation leaders and on-the-ground experts from across the Commonwealth talking about the notion of adverse childhood experiences and environments. You will recall that that some 30 foundations in Kentucky have come together and made that their number one priority. And instead of simply looking at on-the-ground programs, as important as those are, they've made a decision to go upstream and work on state policy. So we introduced that concept to you last week and reviewed exactly what's going on in Kentucky. And you know the facts. You know that a frightening number of Kentucky children, some 44%, have experienced at least one of those traumatic experiences. More than 1 in 4 have experienced 2 or more. We know that is an issue of extreme racial disproportionality because children of color experience that at a significantly higher level than do white kids. We know the impact. We know the impact in the immediate for health outcomes and educational attainment. We know the impact for long-term, literally lifespan, as well as economic vitality. So a really important issue. Today, we wanted to begin talking about how we translate the vision of policy change to reality. And I won't bury the headline, Mahak, but we have 2 legislative leaders in this arena joining us today. My assignment is to, I believe Mahak used the word, to give you a primer on what our plans were. And I see folks like Pam Darnell and Dr. Bargione on this call, and they're experts in this area as well. So I don't want to state the obvious, but I do want to make sure we're on the same page. We see 3 immediate policy opportunities in this area. Number 1 is policy change in the 2022 session. We have had robust conversations with the Mosier administration and Senate leadership. We are slated to have that with House leadership. And the encouraging words that we're hearing is that could be the common agenda. As you know, and we all know, Representative Kulkarni and Moser are on here, and they know this reality, that on many issues, Frankfurt is bifurcated and polarized. When it comes to kids, we need to give our state legislators credit because there is not that division. There's a lot of consensus, a lot of common ground, and this offers one of those opportunities. So we're trying to move that common agenda ahead and beginning to fashion what that would look like. At the moment, we are looking for somewhat of an omnibus package. That's what we've been encouraged to do by both chambers' leadership, as opposed to trying to pass 14 separate measures. Let's go big and let's make a difference. So that's number 1. Number 2, as our legislative guest, I think, would affirm, the issue in 2022 is called the state budget. So that's the time that the General Assembly puts their money where their mouth is. And what I'd love to see is Speaker Osborne, Senator President Stivers, and Governor Mosier join hands together and say, here is a trauma-informed piece of the state budget that we all agree on. There is unprecedented money because of COVID that is on the table. We know that along with just raw money decisions, there's terrific opportunities for federal matches that are unprecedented. So we as Kentuckians, frankly, want to get our fair share. When we think about, for instance, Medicaid match possibilities when it comes to supporting school-based mental and behavioral health, we need to take advantage of every possible dollar that we can do. So we understand that that budget document is really a priorities document. If we don't seize the 2022 budget, we don't have a shot till July 1, 2024. I'm sure the representatives will correct me if I'm wrong, but assuming we're passing a 2-year budget, we got to hit that now. The third opportunity that I am very encouraged about is that we have had robust and very encouraging conversations with Attorney General Cameron. I'm sure that there are billions, not millions, billions on the table around the opioid settlement. Absolutely a significant amount of those funds need to go for immediate relief. We understand that. But we also know that if some of those funds are not used to go upstream to begin changing the trajectory for our children and families, we're going to be facing the same daggone crisis in 20 years that we're facing today. So that is a significant source of funds to support important efforts. So I am entering this work with great optimism. I understand, and I am sure you understand, that this is going to take persistence. The idea that we're going to tackle an issue as complex and complicated as adverse childhood experiences and environments in one session or 2 sessions is naive. So we all have to be in this for the long haul. I see Sarah Ladd from the Courier on here, so I don't want to bury this quote because I've already used it on her. But my metaphor is that when we're tackling the Bloom Initiative, it's a crock pot proposition. It's not a microwave proposition. So we're not going to get this done instantly. The other thing that we're approaching this on is the concept that good is not the enemy of perfect. So Representative Moser, Representative Kulkarni, we know that we're not going to get everything done in exactly the way that we want it done, whether it's policy or budget or opioid settlement. But we do believe that there are good, viable, research-based ideas that cut across party lines, that cut across rural and urban divides, that cut across ideological divisiveness, and that we as a Commonwealth can have a common agenda when it comes to supporting kids and families. That's what the discussion is about. The one thing I will tell you, and I bet Mehek asked Representative Moser and Kulkarni this question, so I'm going to answer it. We need your voice. I'm telling you, as wonderful of leaders as Representative Moser and Representative Kulkarni are, I bet you if you're one of their constituents, they'll answer the phone quicker than if I call them. So all of you have a representative and all of you have a state senator. Get educated, and the time to make them aware of your commitment is now. Don't wait till January. Heat them up now. So we hope that you'll leave this with an action agenda. And helping us today, as I said, is 2 real champions for Kentucky's kids. I think they know that we believe that. And I just want to publicly thank both Nima and Kim for all they do for Kentucky's kids. Mehek Cholera, my colleague, is going to be the moderator and quarterback for the rest of the show. So Mehek, take it away. I hope I read your script correctly.
You did excellent. Thank
Okay.
you, Mary. So I'm going to go and give us a deep dive refresher on the Bloom Kentucky campaign in case you didn't join us last week. So Bloom Kentucky is an initiative supported by several grant maker organizations from across the Commonwealth who are invested in ending adverse childhood experiences, as Terry mentioned. And in order to get to our goal in ending ACEs, the Bloom campaign is focused on state level policy change to prevent and mitigate the impact of childhood adversity. So if you haven't heard the term adverse childhood experiences, or ACEs, they are traumatic or stressful events that occur prior to age 18. We know that ACEs are common, and 22% of Kentucky kids have experienced at least 2 ACEs. That's ranking us in the 14th highest in the nation. And we know that ACEs has a long-term health effects and also relates to overall success and well-being. But there's steps that we could take as a Commonwealth to reduce the impact of ACEs so that kids grow up healthy, hopeful, and contribute to a prosperous future. So as we say with our Blueprint for Kentucky's Children Coalition, we know that thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. And Bloom Kentucky will address the multi-generational challenges of childhood adversity, how communities can help foster opportunities for all children and families, and the future of Kentucky's workforce and prosperities. And we must address adverse community environments in order to address adverse childhood experiences, as Terry mentioned, and challenging environments that kids grow up in, such as poverty, discrimination, community violence, create that negative cycle for even worsening soil for a child's tree of experiences. So with that being said, we have been already collaborating with efforts underway to create that state policy change and secure budget investments. And as you know, as I mentioned, we have been working towards this goal. And so, Kelsey, if you don't mind going to the next slide, we could talk about the timeline of the Bloom campaign. I want to quickly share that we started working on this campaign in June. We first started by gathering qualitative and quantitative data, and Tara will share a little bit more about that in a second. But we really dug into the national and Kentucky assessment, and we've also interviewed experts in the field to help us understand the work, what the need is, and action steps moving forward. And in July, we've analyzed, we heard, we prioritized, and we also shared findings with key stakeholders and a policy work group to get feedback. And this month in August, we did a public launch. And so now where do we go from here, right? So September 1st, we're having our next Bloom policy team meeting. We're really going to dive into what's feasible, what are small wins that we could focus on this upcoming year. And we're going to take back what we hear from Representative Kulkarni and Representative Moser and really help that guide our work as we move forward. So if you have interest in engaging, you have the passion for certain policy priorities you're about to hear, or if you're interested in the Frankfurt policy space, we would love for you to be a part of the policy team and engage with us. And then the next months, we are going to go ahead and, educate our not only legislators, but also the communities on ACEs and the work that needs to be done. So that's our plan moving forward. And I just wanted to take a second to remind us all what we're going to do. So with that being said, I am going to turn it over to Tara.
Thank you, Mahek. Before the discussion, we wanted to share some about the national and Kentucky policy analysis that we did, and also some of the information gathered from stakeholders across the state. So one of the things we started with was just looking at what other states have done. What does it look like across the nation in terms of policies to address adverse childhood experiences? And what we found is that most states do have some legislation on the books addressing adverse childhood experiences. The National Conference of State Legislatures found that 31 states have enacted laws since 2018. And the scope of that legislation varies widely. It ranges from just resolutions to study the issue or look at factors. And some of our neighboring or nearby states have taken that step, like Ohio, also Wisconsin. There are other states who have required education of different groups of professionals. So to make sure that professionals that are interacting with children and families know about this context and can watch for ACEs. And the most intensive has been California, where they've implemented a screening on ACEs in the primary care setting in the medical arena. So there's a whole range of examples we could look to from other states. And Kentucky is not listed as one of the states that has taken action on ACEs because we haven't had that term specifically outlined in any legislation. However, I know many of us on this call can attest to the fact that we have taken steps that you'll see reflected in the research and recommendations on what is effective. So some examples of that: in past years, in recent years, we've taken steps to strengthen the child care subsidy for working families. We have enhanced funding for the HANDS program. We have done extensive work on trauma-informed care in schools, and we have taken steps, and I believe Representative Moser, you've been a big part of this, on reducing unnecessary parental incarceration and the impacts that can have on children. So as Mehek mentioned, also, let's move on to the next slide really quickly. And another piece of the work that we did was looking at what the recommendations are nationally. There has been some extensive research looking at what types of programming can address ACEs for children. And when you look at this table that kind of summarizes strategies and approaches that are proven to have an impact, what you see in a positive way, I believe, is that these are not new strategies to Kentucky or to the blueprint for Kentucky's children. I see that as a great positive because we can build on the work that we've already been doing as a state and in our advocacy for kids. One other piece of context on the next slide is just sharing a little bit about the interviews and who we got information from. As we were doing this information gathering at the beginning of the process, we wanted to pair that look at the national landscape and state policies and the research with getting input from experts in the field. And so here in Kentucky, we conducted 35 interviews with people from these professions listed here. And our goals were really to get insight on the general understanding of ACEs already present in our state, learning more about the root causes and how we understand how those root causes interact. And then also hearing recommendations from folks who work in the field about programmatic practice or policy changes that we could implement to mitigate or prevent ACEs. So with that, I'm going to just share a highlight of some of the policy areas that have been discussed. As Mehek mentioned, in July, we convened a group of folks and we started to look at what proven strategies are to address adverse childhood experiences. And we will begin and continue that work of thinking about what the potential is in the Kentucky policy context. What these priorities are listed according to those strategies that were identified in the research document that was shown earlier in that table. And within each of these, we do have a number of policy areas that partners have identified that we will be digging into more. As you can see, some of them have a dollar sign next to them, and those would be ones that would have a budget impact. So that is something to consider during this upcoming legislative session for sure. In the area of strengthening economic supports to families, there are a number of ways that this can be done. And part of it, many of these policies look at ensuring that families who are working earn enough to meet basic needs. If they can't meet basic needs, what are we doing? What can we do to support families who fall short? There is more and more evidence coming out about how concrete supports, if we can provide them early to families, can protect against families getting involved in the child welfare system. And in the budget context, when we're thinking about budget expenses, it's important work, but also very costly when children are in the child welfare system. Some examples that you can see listed here are paid family leave, which would allow families to care for newborns without having those economic struggles or decisions to make about how they can still make ends meet and take that time with their newborn baby or adopted child. There's also evidence that a policy like that can reduce pediatric abusive head trauma because of its impact on reducing stress during those critical first weeks. Another idea that has been raised is looking at making sure we ensure funding for programs that address hunger, like SNAP and WIC, or programming that helps support families that take in and care for children who have been removed from their parents. When we look at the next sector, promoting social norms that protect against violence and adversity, this strategy is really focused on educating and setting the tone for how communities can help protect against adverse experiences. One specific piece on this that we've been talking about in Kentucky is a legislative proposal, and they mention legislative approach specifically to eliminate corporal punishment in schools, because this would have an impact well beyond the schools and the children that are directly impacted. If we go to the next slide, a potential strategy area that we have done a lot of work on as a state is ensuring a strong start for children. And certainly we can build on those areas and help those programs that we know work and do meet the needs of families, that we are able to meet additional families. A number of these examples are ones I actually talked about a moment ago as ones where Kentucky has taken action with investments in hands and expanding access to the child care assistance program so children have a safe place while their parents are at work. So we have a strong foundation here, and we can build on that. Another strategy is teaching skills. And this is where we've taken steps in terms of education to address serious challenges like pediatric abusive head trauma. And we may want to look at this for expanding knowledge for our professionals out in the communities who are interacting specifically with kids and families. So they have that knowledge of ACEs, and they can understand and work to intervene. Because as Terry and Mehek, I believe, both mentioned, we know that ACEs have such an impact now, and that impact continues into the future in so many arenas. Another strategy is connecting youth to caring adults and activities. Again, we have a lot of great programs here in the state that reach some children and families, and it's important to think about the potential for reaching others through programming like Boys and Girls Clubs or Big Brothers Big Sisters, programs where we can mentor youth and provide them positive engagement activities. And I've saved the biggest for last, ideas on how to intervene to lessen the immediate and the long-term harms of ACEs. So there are so many opportunities here. When we have identified adverse childhood experiences, there's so many ways that we can intervene and help address those issues so that a child doesn't carry those forward into the future. And these interventions can take many forms. Part of it is looking at how can we better identify ACEs in the populations we're working with. As I mentioned, California has taken a step of screening for them in the healthcare setting. But a place like Wisconsin has taken an approach where in all of their programming with children, they're looking more intently at ACEs with all the kids that come through and interact with systems. And my dog clearly has lots of thoughts about this approach too, because he is weighing in the background. I apologize for that. The other approach is once we have identified, if we can find ways to strengthen our identification of kids and families who are struggling with ACEs, then what are some areas where we can support with programming to get to the core of the issue and resolve it so that kids are not carrying that forward and families aren't carrying the burden of those ACEs forward and impacting their future stability. Some of the examples on this list you will see are areas that we have taken steps on and we can do more. Making sure we have access to family-centered substance use disorder treatment. So that is working with a parent who's struggling with a substance use disorder and providing a family-centered approach to that too. Another area that has been mentioned today already, addressing the impact of parental incarceration. What can we do to minimize incarceration when it's not critical? What can we do to consider when someone is a caregiver and what that impact would have on the child? And another area that you'll see listed on here is looking at funding effective in-school treatment for children? Are there ways we can, once we've identified a child is struggling, that we can support that child with the treatment that will benefit them now and in the future? So with that, I'm going to turn it back over to Mahek to fill in any other policy ideas and to take us on to the discussion.
Thanks, Tara. That's a wealth of information. So there's some immediate ways to engage right now. So if you are animated by any of the policy priorities, as I mentioned, please join the Bloom policy team meetings. We're having one in September. We request, also there's an opportunity to request ACEs presentation for your organization or network. Also, as Terry mentioned, we encourage you to connect with your state senator and your state representative, and also executive branch leadership to share the impact of ACEs in your community and potential policy opportunities with Bloom Kentucky. And then lastly, visit the Bloom Kentucky webpage that we have listed here. So those are just a quick primer before we go ahead and have our conversation with our representatives that are joining us here today. But before I do that, I do want to take a second to welcome and thank the new Department of Justice, Juvenile Justice Commissioner Vicki Reed for joining us this morning. So hello and welcome, and thank you for joining us today. So now that we've heard potential policy buckets and budget themes and ways to engage, we will hear from two elected officials, Representative Nima Kulkarni, who represents District 40, which is a part of Jefferson County, and Representative Kim Moser, who represents District 64, which is a part of Campbell and Kenton County. And Representative Moser is also the chair of the House Health and Family Services Committee as well. So welcome and thank you for joining us.
It's a pleasure.
Thank you for having us.
Well, thank you both. So as you heard, Tara discussed policy ideas that are proven to address ACEs and have a potential in the Kentucky policy context. So of those policy priorities or budget priorities mentioned, what has traction among your legislative colleagues this upcoming year? And this is an open question to both of you all, so feel free, whoever wants to start us off.
I'll defer to Rep. Moser.
Well, thanks, Nima, and thank you all. Thanks, Terry and Tara and Mahek for having us this morning. I love this conversation. I love the Bloom Kentucky initiative. I am a huge fan of strategic plans, and this feels very strategic to me. I love data-driven policy, and I think that's really what resonates with many of our members. That's really convincing. I think that we've all heard the term ACEs. Many of us understand what adverse childhood experiences are and how they really affect children through their lifespan. And we are very consciously looking at underlying causes of adverse childhood experiences. And that really is what drives much of the policy that I work on. And so I think when we talk about specific initiatives, and I can and I will, but I also think that we really need to look systematically at what we have in place and how we can really either reform or improve on what we have. An example of this is something that I'm working on both with the cabinet and with partners in the community, are community health workers. And how do we really best utilize these folks and give them an opportunity to step into this really underserved area where we have a health worker shortage. So, how do we embed folks who can look at social determinants of health and really get to the crux of what we need to be working on? So that's one example. We've spent a lot of time working on foster care and DCBS issues. That's another systematic approach, I think. We have talked a great deal about mental health coverage and treatment. Again, trying to not only put policies in place, but look systematically at what we have and how it's either working or it isn't. A bill that I passed a couple of years ago, House Bill 120 9, I almost got it wrong, was the DPH transformation. And I think that that was a really good example of how to get back to those core and foundational services to really address how we best serve people through the state. And that particular piece of legislation dealt with a lot of things, but the crux was staffing ratios. So again, creating an equitable system across the state and really taking a hard look at that system. We can get into the opioid issue, early childhood education, which I personally believe is how we break the cycle of some of the really dysfunctional and dangerous things that we see happening with kids. So there's a lot to talk about. I think that we have made a lot of headway. We are putting things in place that really do address ACEs, no matter what NCSL says. I might have a conversation with them about, hey, and I actually have done that in other areas where Kentucky wasn't listed. And I think that we really have some good policies that we've put in place that could be helpful to other states, whether or not ACEs is in the title. So I'll stop there. I'm happy to be here, happy to talk about all of this. This is really my one of my passions. So thanks for having us.
And I'll just jump in real quick. I want to thank all of you for inviting me. I'm happy to be here with Rep. Moser, who has such a wealth of information and experience in this field. I tend to look at things on a broader level because, as Rep. Moser mentioned, there are a lot of things in place. There are a lot of specific policies that she herself has worked on and that have been worked on by other legislators in the past. The things that stuck out to me, as we all know on this call, is the generational nature of ACEs. And I think that is a crucial point that sometimes gets lost in policy conversations, because you're then talking about a specific bill that does a specific thing, which will have an impact, right? But it's difficult sometimes to articulate the generational nature of it, or why it's so important to allocate funding for it now so that we see results in 10, 20 years. And I think that is one thing that is really, really important for advocates to do, is for legislators that are not familiar with some of these terms, some of these impacts, is just to connect the dots. This bill does this very specific thing, and it sounds very technical, but here's the real world impact. This is a family this is going to affect. And I think that is something that is, again, very, very important for folks that maybe aren't already working in the field or have subject matter expertise in any of these. And I think one of the other things is, ACEs are very subjective, right? You'll never get a comprehensive list of every single adverse event that could potentially lead to trauma in a child. One of the things that, and I'll draw on my own experience here a little bit, I was born in India. My family moved to Louisville, Kentucky, so that my brother, who has learning differences, could attend the DePaul school, right? So that's kind of a quintessential story. And we, left a lot. So I was used to, in my early childhood, having a pretty comfortable life. And then we moved here, my parents couldn't find a job, et cetera, et cetera. But the issue is that no matter what, in terms of economic deprivation or instability in terms of geography, I wasn't ever feeling the brunt of it and wasn't traumatized because I had a stable family structure. It was, I always knew my parents were going to come home, no matter, where they were, or if they're working in the store or if they were late. And I knew also that they loved me. We had food on the table, we had shelter. The size of the house maybe didn't matter as much as just the fact that I have a stable family situation. And I think that is crucial. And that no matter what policies we look at, things like paid family leave, things like making sure childcare is available, because that then leads into the workforce question. I'm an immigration attorney. I work with companies. And I see all the time as a legislator, all of the committee meetings I've been to, there's been some testimony about people not being able to find workers. The pandemic has highlighted a lot of the stark differences between people that could work from home and people that simply could not because of the nature of their employment. And I think that is another sort of broad picture that we need to be able to draw for legislators. When you talk about higher wages, or you talk about childcare, or you talk about early childhood education, why is all of that necessary for a parent or parents to be able to simply go to work with some peace of mind and be productive and be present in their jobs, so that they can in turn earn a wage, to put food, and clothing and have shelter for their child. I think one of the things we need to look at, so a bill that I've worked on, for the past couple of sessions, is extending unemployment benefits to victims of, or people that find themselves in domestic violence situations or stalking, or who are victims of assault. And I think things like that, that's a very specific thing, but it's really, really important because it highlights something about our work environment, where a person who is physically in danger and maybe a child that's witnessing violence every day is unable to leave that situation because of a job. And that's it. If we just had an interim period of time where they were able to still feed and clothe their child, they would leave. And that's just one aspect. And so just connecting the dots in terms of what a specific bill does in terms of real world impact is really crucial. And I will stop with this last point. As an immigrant, I think it's really important to understand cultural differences and cultural adversity. We did not come here as refugees. We were not seeking asylum. We came here seeking opportunity, and we survived and thrived. We did not have a lot of the issues that you're finding folks that maybe come here as refugees have had to flee just insanely traumatic experiences in their home country. So you have parents who are traumatized by what's happened, and then you have children that are traumatized. And we do not have, I don't think, enough infrastructure, enough outreach in terms of mental health care to address those underlying traumas in the families and the children. And that could bleed into the first generation as well of kids that are born here, because those issues are never really addressed, never really talked about, because people are simply trying to find jobs and survive. And so that's just another point I'd like to make in terms of policy, or just keeping that in mind as we move forward.
Thank you both. That was a lot to process. I mean, I think you brought some great strategies, and not strategies, I should say, but policies in particular, but also touched on strategies. And that kind of dives us into our next and guides us to our next question is, what have been some effective strategies that you've seen from advocates in Frankfurt? Representative Kulkarni, you mentioned, connecting the dots. That's important, and, showing that linear picture of what would happen to that family or community. But Representative Moser, do you have anything else to add, or some effective strategies you've seen?
Sure. And kind of picking up where Nima left off, I would say that, and I'm not an immigrant, and so I don't, pretend to really understand the cultural issues, but I think that we've put some policies in place that would assist those families. And one that I can think of off the top of my head, and it was a state plan amendment to Medicaid, is the school-based healthcare system. And I think that can really be expanded. We have telehealth laws in place now that would really allow healthcare workers to reach families who might be having a difficult time, students who might be having a difficult time for a variety of reasons. And so I do think that that's it was a cabinet decision, obviously, but it's one that we support. And if there's a way to really expand that and improve upon that, that would be, I think, a really worthy goal. I think the goal of having a nurse in every school, or increasing school counselors, is another way to reach students. Public school education tends to be kind of the common denominator. It's, we don't want to put more and more on schools. And so this is really a support network for our teachers who have a tremendous amount on their plate, and they are dealing with the cultural issues that kids come to school with, whether they be an immigrant or just, have some family differences. So I do think that that's one place to start. We funded all-day kindergarten. Again, that early childhood learning and education, I think, is really critical. We have now the Family First Act skipping over to DCBS and the foster care system. And so we have some new federal provisions that are guidelines, if you will, for how we can really look at policies to assist families and finding some permanency for kids, really finding ways to support those families who we know oftentimes and most times it's in the best interest of the children to stay with their families. And so I think it's important that we look at some of those policies as well. Education and workforce, how do we best support folks who have lost their jobs during the pandemic? What are the barriers? And so I think it's important that you as advocates are coming to us and really informing us on best practices and what's going on in the community. And so I think that's where the advocates really come in to really inform and educate legislators. Just as a refresher, we are a citizen-based legislature. We all have different jobs. And so our area of expertise may not be healthcare and it may not be social services. So keep that in mind when you're coming to speak to your legislators. And I'm sure you've got questions about that. We can get into that a little bit later. But we do have some, I think that we have some really important things to work on. I'm working on a bridge insurance work group right now with the Secretary of the Cabinet for Health and Family Services. And that really is a way to look at a state workaround for the benefit cliff, which again, directly addresses those people who are relying on government assistance and their inability really to move forward in their job or to get a raise without risking losing their benefits. So we do need to think about a lot of these things. And then last, I'll mention criminal justice reforms. I am keenly interested in the over-incarceration and the addiction and substance use issues that we have, and some of the reentry policies that we can strengthen. So I've worked on that. I will continue to work on that. There are a lot of really critical pieces in that particular space.
Thank you for that, Representative Moser. Representative Kulkarni, are there other effective strategies that you've seen from advocates in Frankfurt that would be helpful for us as a coalition moving forward?
Yeah, I mean, I think one of the things as advocates too is identifying legislators that are working in this space already, like Rep. Moser, right? So she's got a wealth of experience. And so who can be partners in your work to advocate for a specific policy or for a specific issue? I think having legislative partners is crucial. I think it helps when it comes from a fellow legislator in terms of explaining what this bill would do, what are the issues maybe that would impact your specific district, so we can have those conversations with our colleagues separate and apart from the policy, technicalities of the policy itself. I think that's important. And I think it's really important anytime you're going in and talking to a legislator who you don't know is already familiar with some of these issues, is really be mindful of, you might be starting at ground zero, right? This person does not know a whole lot about this particular topic. Maybe it's criminal justice, maybe it's early childhood education, maybe it's healthcare, maybe, as broad or specific as you want. So I think just being able to, again, to connect it to how this bill would impact a family in that legislator's district is always an easy way to communicate the importance of that policy.
Is there anything else that you would like to add, Representative Moser?
Well, I agree wholeheartedly with Nima. Coming to speak to your legislators, sometimes you are starting at ground zero. it's important to know a little bit about your legislator, kind of what he or she has worked on in the past when you come to visit as well. I would just throw that in. You know, unless you have specific questions about policy, I think that really, you know, touches on some of the more important issues. Certainly we have funding issues. We are coming into a budget year, a true budget year. Last year was an anomaly, but we should really come in, and I love that you have a plan. You've outlined priorities, and I think that that's important to really highlight what your priorities are, because there is so much we can do. I think that you know, if we try to do it all, maybe Terry's right, we put an omnibus bill together and we can start the conversation, but we really do need to prioritize what we think is going to be the most impactful.
Definitely. So how might advocates discuss a specific topic with legislators they might not be familiar with? I think you guys touched on that really a little bit, but I think just diving in a little bit deeper, knowing that some legislators, this might be the first time they've heard the term ACEs. I know you both are very familiar, but what are some tips and tricks that we as advocates can do here today on this call or after this call?
I love infographics. I love leave behinds. If you can put something together that is a quick look, quick education with resources, but I wouldn't put together a 20-page dissertation on ACEs. But you know, we like pictures, we like bullet points. And then certainly you can answer questions. You can come to your legislators and say, how can we help you? How can we help you understand this issue? And I think Nima's right, come with stories about how this has impacted folks in your district. Generally, these are the people that we are having coffee with in our district. We are getting phone calls. You know, I see them when I'm walking. I see my constituents when I'm walking in my area. So I think that you know, those stories are really helpful. I'm working, for example, with some grandparents who have raised their grandchildren since birth, and they've identified some real issues in the foster care system that I think that as we want to keep children with their families, and we've addressed kind of the fictive kin aspect of foster care and keeping children with those that they know and love, we still have some issues with the grandparents. And so that's one example of an issue or several issues really, that have been brought to me by my constituents.
We might be connecting with you after this call.
Please do. Yeah.
And I'll just echo what Rep. Moser was saying. Most, if not all, of my bills have come from constituents or advocates. And it's something much more personal and much more impactful if that's the source. Because this is somebody coming to you with a specific problem they're experiencing that you can try to help with. I think somebody put in the chat, look up maybe some bills that legislators have filed or have primary co-sponsors on. So some homework you can do, as both Mahek and Terry mentioned, and I think Rep. Moser emphasizes, find out, right, who your state rep and who your state senators are, and then find out what bills they've worked on, right? So you'll find that I've got bills I've worked on for the past couple of sessions. So, you know, filing, refiling, maybe retooling a little bit here and there, but the issues remain the same. And so that is true, certainly, of legislators that have been there a lot longer. So they will have some signature issues that they are, that they are very passionate about. So just learn about that primary and co-sponsorship or primary sponsorship of the bill. And just, also one of the things that helped me as a legislator is just trying to find out what work groups have been organized in the past and what have they been around? Like, what is our legislature prioritized in terms of doing a deep dive into a particular issue? We had the Public Assistance Reform Task Force. We have this task force based on House Joint Resolution 57. And so there are different task forces that are convened, statutory task forces that address some of these issues. And so, a lot of you may have testified before some of these task forces, but just it helped me as a new legislator. And by the way, there are a lot of new legislators, folks that have been there for 2 terms or less at this point. And so you're going to have a lot of folks that aren't familiar necessarily with everything that's come before, and it would help them. So if you know somebody's brand new, just if there's an issue, find out if they're familiar with it, but then also inform them that, yes, our legislature actually did focus on this a while ago. It's important, it's bipartisan, and then you can get into the specifics of it. But I think those are some points that would kind of help connect with your legislator.
That's a great reminder. So I'm going to end with this last question. As you both know, we are working to end ACEs. I mean, that's our goal with the Bloom campaign. So if you had a magic wand, a hypothetical one, or if you have one near you, just asking, how would you prevent and mitigate the impact of childhood adversity?
Wow, that's a tough one, Mahek. One thing, I think connecting youth to those caring adults and activities. I mean, getting back to the core issues that we see with kids, and just understanding that if we don't address this issue now, and we see this, I think that it hasn't been addressed wholeheartedly and systematically in the past. And so we're seeing kids who are really experiencing ACEs at a much higher level than ever before. And even before the pandemic, I think a lot of it has to do with, the substance use disorder is a symptom of a lot of these issues. And so, I think I just think that really addressing addressing the family needs. I don't know how to say it better. We've got kids in schools, and that's an automatic connection. Our healthcare system, most kids go to a doctor at some point. They go to a clinic, or they see a healthcare professional at some point. And so helping healthcare professionals really understand social determinants of health and those adverse childhood experiences. And I think that going back to the community health worker, really embedding people who can take the time to understand a family's or a child's difficulties and connect them to resources that make a difference. So there are so many things that we can do, but I think really getting back to those connections is critical.
And I'll echo what Rep. Moser said. I will say that it's maybe important to recognize that we may never be able to eliminate ACEs, simply because we will never be able to eliminate all of the different forms of trauma and the sources of trauma that will occur in a child's life. What we can do is try to mitigate them and identify them. And so that requires creating a safe, supportive system of support for the child, right? And make sure there are adults they can reach out to. One of the things I think it's important to remember is that, we don't know what it's like in this country for everybody to have affordable housing, for everybody to have a wage that they can live on, for everybody to have childcare. We don't know what that looks like. And so what we What we are not sure of, but we know we can try to mitigate at least a little bit, is those issues in terms of employment, in terms of childcare, in terms of how we approach some of our, and it ties into like economic development, it ties into education, it ties into healthcare. Our systems are not designed to look at these issues holistically. So we are always reacting to the trauma or to the urgent need at hand. And so we don't know what it's like to have just a system in place that prioritizes families and then deal with, the ACEs that may still result. And so I think this notion of putting out fires even needs to be looked at a little bit more systematically. And Rep. Moser has mentioned criminal justice reform. We are one of the highest incarcerators in the world, both for women and just, generally in the world. So globally, we are near the top, and certainly we're, I think, the top in Kentucky for women incarcerated. And that's an issue right there. There's just making sure kids are fed, kids are healthy. But I think we really just need to recognize that this is an issue, ACEs, that we should be looking at systemically and structurally in terms of all of the different factors that go into it, whether it's economic, whether it's emotional, whether it's somebody coming over as a refugee, and all of the attendant issues that they're going to be dealing with. That we try to look at it both in a big picture, which I think this Bloom initiative is trying to do, and we look at the specific policies, and that's a tall order. But again, this is a generational problem that we're going to need to look at generationally.
Well, thank you both for being rock star legislators and being champions for kids. We've appreciated the time that we've had with both of you here today. I am now going to turn it over to my colleague Shannon Moody to close us out.
Thanks, Mahek, and thanks again so much to Representatives Kulkarni and Moser. I think today we heard that our work is cut out for us, but we are optimistic. What we know is that mitigating and preventing ACEs is going to be a crock-pot strategy rather than a microwave, but we do see a lot of potential with the upcoming legislative session, supportive legislators like those you heard from today, and then also leveraging federal funds and opioid settlement funds to get us to our goal. Some things that we heard today is know who your legislators are and partner with them to build knowledge and come with stories about individuals in their districts. Do some homework before you meet with them to get to know what their interest areas are. Leave behind like quick educational tools with images, bullet points, something easy to consume is helpful in getting them to understand the issue, and then also help them connect the dots between the proposed policy change and the real world impact on kids and families. And finally, when it comes to ending ACEs, relationships and connection matters for resilience building and prevention. We also want to thank Aetna Better Health of Kentucky for their support for today's Advocate Virtual Forum. For next week's upcoming forum on August 25th, join us for a conversation with various stakeholders, including our partners at Aetna Better Health, where we discuss all things vaccinations. And as always, the follow-up email will include a recording of today's forum, along with resources we discussed and a link to sign up for next week's forum. And thanks again for joining us, and we hope you have a good rest of your day.